Good evening. I've met all of you this morning. So I'll address my remarks, some of which you may have heard already, and I hope that I don't bore you first-year students. We spoke this morning not only of a particular course that we were dealing with, but we spoke of some of the competencies that are expected today of all medical graduates. In thinking about the white coat ceremony, I reviewed some of the literature and discovered that the ceremony is actually quite a young one. That the first 3 ceremonies noted were only less than 20 years ago, which, depending on where you sit on the age spectrum, may seem a long time ago or not. But by now, of 170 odd schools in the American Association of Medical Colleges, there are over 100 schools that have white coat ceremonies today. And we're happy to join that group. Some of the schools, however, delay the donning of the white coat until what are deemed the clinical years, or the clinical clerkship, usually around the 3rd year of 4. I think, though, that it's an important message to you all that we choose to join those schools that don the white coat at the very beginning, in fact, on the first day of your medical studies. The wearing of the white coat, even though you may not actually be wearing it in a clinical setting in a hospital or a clinic for many months to come, is symbolic in the fact that by doing so, you are committing yourself to achieving those competencies. Not only the scientific knowledge that we talked about this morning, that is an important and indispensable part of becoming a physician, but also the communication skills, the honesty, the altruism, and the professional behavior that we in our own community expect of you, but also the public, your patients, and your families expect and even demand of you. And so as you don the white coat today, you join, as my colleague mentioned, a very exclusive and quite well-knit community that asks of you to think about all these competencies as you go through both the preclinical studies and the clinical studies as one. I wish you all the best of luck in your studies and everything that comes after that. It's really lifelong studies for all of us. Good luck.
Thank you, Dr. Shaw. Dr. Gary Diamond will now share the start.
These are going to be, for most of you, these are going to be the best years of your lives. It's all downhill from here. Never again will you know as much about so many things as you will during your medical school years. And then again, you'll also realize how little you know about so few things. Yes, medical school is a real eye-opener. You'll go through a tremendous metamorphosis of going from looking from the outside in to looking from the inside out. You'll discover you've got the guts, you'll discover you've got the skills, and you'll discover you've got the brains. And the thing that medical school will teach you is how to use all 3 of them in the service of healing the body and the soul of your fellow man. But most of all, you'll discover within yourselves your feeling heart. And may it forever be your guide to empathize with and just be able to be there for another human being coming to you, not to cure them, but just for solace and comfort. My job with you is going to come into play, especially during your 3rd and 4th years. And my job is to get to know you inside and out, especially after the maturing stage of your first 2 preclinical years. From that vantage point, I hope to be able to work with you on your recommendations and dean's letters in order to help you land the residency of your choice. And by God, we're going to get those residencies for you in order to make you the doctors that you always dreamed of becoming. This year is especially poignant for me as a Sackler alumnus, class of '82. I feel great pride in this school and for the fine tradition it's established in producing the best physicians America and Israel have to offer. Especially with this class, where my own and my colleagues' children are among you, taking their rightful place in these hallowed halls to continue that wonderful legacy. So, for the rest of you, be kind to them, be merciful, and solicitous, for they have a heavy burden to live down. So welcome to Sackler, and hit the ground running. Thank you.
Thank you, Dr. Diamond. Now, Professor Fick and Leah Shulman will come to the stage, and we will start the student elections. I ask the first row to please rise. And as I call your name, you'll come here.
Here's on here too, yeah.
Your right hand. And starting with Alexander Abdurrahman.
Yeah.
At least they're better now.
Michael Allen.
Hey, Mike.
David Hampton. Jessica Barenboim. Joy Barlow. Aharon Beneliao. Ariel Gamon. Jacqueline Gilbert.
Check it.
Angela Lucille.
Hey,
Lauren Geneva.
Oh, yeah, whatever.
Oren
Close enough.
Kuhn.
Yeah, Oren!
Randall Conatiano.
Yeah, Doc!
Tamir
No, whatever.
Diamond. Alexandra Eventi. Ishai Feldman.
Oh, I came one down too far. Sorry.
Oh, you came on that.
Sarah Gunn. For the second row, please rise, and I'll start playing your games.
Right.
Debbie Goodman.
Oh, yeah, I'm gonna stand here.
Yaniv Gura.
Yeah, Yaniv! Woo! Yeah, Canada!
Alexander Heffel. Benjamin Hurwitz. Jay Ivan.
Yeah, Jay.
Quentin Captain. Mark Klein. Rosalie Kogan. Bennett Kramer.
Yes, Tony Brook.
Evan Lieberman.
Yeah, Mort.
Derek Lucas.
Mr. Lacus.